So the government has scrapped the NHS contact tracing app it spent 3 months developing after discovering it only recognised 4% of iPhones tested.
Yeah, not great, is it? But instead it's shifted to an alternative model designed by Apple and Google, which won't use a centralised system to hold users' data. So where did it all go wrong? Well, from South West London, we're speaking to Dr. Zubaida Haque, Interim Director of the Runnymede Trust and an independent member of SAGE, the scientific group that advises the government. She says the switch is a result of bad decisions based on no evidence. From Suffolk, we're joined by the Conservative MP Dan Poulter. He's a doctor and a former health minister who says we should have learned lessons from past failures when the NHS spent billions on an IT system that was never used. And the Labour MP Barry Gardiner from North West London, who says the government has been over-promising and under-delivering, and this is yet another failure in dealing with coronavirus. Good morning to all of you. Thanks very much for joining us this morning. Let's come to you, first of all, Dr. Haque. And if I can ask you, I mean, you say there that it's a result of bad decisions from the government, but, you know, they wanted to be able to test this out. Is this a good decision, then, that they've therefore decided it's not working? They need to move on with a different form of an app to make it work?
They've literally been stumbling from one bad decision to another. I mean, this app, this app came very late. I mean, for months and months, the government knew that they needed to have a test, tracing, isolating and support program in place. And instead, they waited until around May to announce this app. And even then, the independent SAGE group said, listen, this app is going to be a big problem, not only because when it comes to access to digital things, a large proportion of the population don't have access. Elderly people have less access to digital things, like iPhones and so on. That's going to be a problem. But also, you don't develop a test and tracing and isolating program without the local community, without local public health, without GPs, without school nurses, without the entire local public health infrastructure. We have a very good and excellent local infrastructure that knows the local population, that knows what they're afraid of, that knows that they have fears and stigmas, you know, and so on. So they know how to find those people, they know how to test those people, and they know how to follow up with those people. But more importantly than anything else, local people trust local public health officials. They wouldn't trust an app, and we knew from the outset it was plagued with problems.
I mean, the government will argue that they're just following scientific advice. They haven't made this decision just sitting in a room on their own. They will have been given all the pros and cons on the various systems, and it's scientists like yourselves that are advising the government, and that's why they've ended up here. And surely they give this one a go. It turns out to not be the one to follow. Let's cut our losses. And it's, you know, and let's go with an app that potentially could work. And you know, they haven't just made this because they fancied using their own app, surely.
Yeah, it's become an absolute euphemism that when this government says that they are following the science, that they are guided by the science, because what's become absolutely clear is that the last thing they're doing is following science. We knew that when they were opening schools, that all the modelling that they did, all the modelling that the Scientific Advisory Group for Emergencies did, they didn't base their answers on that. They didn't base their policies on that. And even independent SAGE, which I am a member of, said to them, listen, we've done the modelling. It's not a good idea to open schools on the 1st of June, because if you open schools on the 1st of June without a test, tracking and isolating and support program in place, then actually you're exposing a lot of vulnerable people to getting coronavirus. And more than that, it was very risky for children. We told them to wait, but they ignored all of that. So this government doesn't follow the scientific advice. It just follows politics.
Let's go. Well, let's go to Dan Poulter. Dan, you're a Conservative MP based in Suffolk. You're a doctor, former health minister. You say we should have learned from the lessons of the past, the NHS IT failure that cost billions as well. And there's an important point that Dr. Haque's making there, which is about confidence. It's about confidence in the system. It's about confidence in the government. And it feels like the government are stumbling from one mistake to another. How frustrated are you with the situation as it stands?
Well, I mean, I'm pleased overall in the UK, the rate of coronavirus is falling, the number of deaths are falling. Working on the front line of the NHS, which has been incredibly challenging, it's still hard, but it's becoming easier. So there are some good things that are happening in terms of coronavirus. But I don't disagree that there have been challenges developing an effective contact tracing app. The history in the NHS of using centrally imposed technology is not a good one. We saw many years ago under previous government £10 billion wasted on a centralised IT system that was never fit for purpose. And indeed other countries, if you look at France and Germany, elsewhere, have struggled to develop their own contact tracing app technology. Now, when there is already available technology from Google and Apple, that strikes me as something that we should be much more actively engaging with and working with. But the good news is there is time. We don't believe at the moment there is likely to be a second wave of coronavirus with rates going down probably until the autumn. That's not an exact science in predicting these things. And we've also got to look at the fact that it's not just about a contact tracing app. Effective contact tracing is also about building up an army of human contact tracers. And I agree entirely with Dr. Haque that that's got to be done at a local level. And we need to now be putting additional resources in to support our local councils, who are the public health authorities in many areas, to build up the resources and the manpower that they need to make sure that they can be prepared for what may well be a very difficult winter for the NHS with this second coronavirus.
Do you think, though, there's a difficulty with public trust in this, though? Because this is the latest in a long line of failures that we've seen and how the government's handled this. You know, we've seen how the PPE supply broke down. There wasn't enough getting through. Protecting care homes, that didn't work at all. Testing enough people, contacting people, now the app. And we have a horrific death rate. It's a horrific statistic that we're up to now, and it's an embarrassment for the government, isn't it, how this has all been handled?
I don't entirely agree with that. I mean, the death rate, it's very difficult to compare the death rate in this country to other death rates when we're not always comparing like for like. For example, at the moment, doctors in the UK are putting coronavirus as a cause of death, even when it, on the death certificate, even when it may not have been the primary cause of death. And we're counting that in our statistics. So I think we need to look at death rates in the context of what we're doing in this country, which is not always the same way of recording deaths as is happening overseas. And but on the broader issue of public trust, you know, I think the public recognises this is an unprecedented situation. We need to obviously make good decisions where we can and follow scientific advice. I believe broadly that's what the government has been doing. Of course, there are going to be mistakes. Of course, not everything has gone perfectly. But on the big calls and in helping to get coronavirus under control in this country, we're in a good place. And I think that's something that we should hold on to at this time.
OK, well, let's put that to Barry Gardiner, of course. I think you probably have a different position. Do you think the government have been doing some good things, Barry? I mean, this is a situation that we're all hearing about. We were going to have this world-class test and trace app. We were going to have a test and trace app that was going to be the way out of lockdown. The WHO says don't start loosening lockdown until you've got a test and trace app. And all of a sudden, the one that money has been spent and time has been spent developing is being scrapped.
Ben, look, the most important thing that you have in an epidemic is time. And I'm afraid it's the most precious resource, and it's being wasted by the government. It was wasted when we were going into lockdown. It was wasted in ordering the PPE. It was wasted setting up a testing system. And we know now that on the 11th of April, the technical experts at UCL told the government that their way of doing this was not going to work. And yet here we are, 2 months later, with the government now having to backtrack, 2 months wasted. If you look at what happened on the whole start of this, when the government was talking about herd immunity, the Prime Minister said, maybe we can take it on the chin and allow this disease just to move through the population. Then they had to backtrack before they then started taking seriously the importance of going into lockdown. New Zealand went into lockdown when it had 102 cases. Yesterday, we had 135 deaths. That's the difference. If you take early action, then you save lives. And at each stage, the government has been too late and trying to catch up. And then when something's gone wrong, what they've had to do is they've had to snatch for a headline somewhere. And so, when it was the height of the PPE crisis, we were told, don't worry, we're going to have 100,000 tests a day. And then when we got to be the highest death rate in Europe, we were told, don't worry, we're going to have this world-beating contact tracing app. And at each stage, they have overpromised, under-delivered, time has been wasted, lives have been lost.
So, Barry, what do you want to see from the government right now? How can they sort of rescue this situation in your eyes and in the eyes of a lot of the British public who are losing confidence?
Well, I think what they should now be doing is they should be looking at the model that's been just rolled out in Switzerland. Germany, we're told yesterday, had 5.5 million people sign up to their app on day one. I think they need to look at the way in which the Google Apple model is working in other countries and see how they can appropriate that here as quickly as possible. But I absolutely agree with your expert from Independent Sage, who said this is about local communities taking the action that they know how to do, that they're used to doing in terms of tracing the disease as it goes through the local community. That's where trust lies. There is a local reservoir of trust that people have for their local health professionals. And unfortunately, the government tried to centralise this, to control it in a way that they kept all the information and fed it out. That didn't work.
Dan Poulter, something I wanted to pick up with you as well was we saw these pictures of Matt Hancock in Parliament where he wasn't adhering to the social distancing regulations. He wasn't keeping 2 metres away. At one point, he even puts an arm out there, as we can see, towards a colleague. It's not a great example, is it, for the rest of the population who've been doing their best to stick to these measures? Just like with Dominic Cummings, there is this feeling that it's one rule for them and one rule for everybody else.
Well, certainly. I mean, I saw the pictures. I've been working largely in the NHS this week and haven't been in Parliament as much. But I saw the pictures. I don't disagree that it is an onus on all of us to set good example. And I'm sure Matt has apologised for that and made clear that that was a mistake. I mean, one of the problems that struck me when I have been into Parliament is that it is not like the world that I've just come across from working on the front line of the NHS. Far too many of my MP colleagues are relaxed, and Barry, who's one of your guests, I think also came under fire for joining, losing social distancing when he was joining a protest recently. We've got to recognise that as community leaders, we have a responsibility to try and set a good example, and that means enforcing social distancing. And the reality is in Parliament that people forget that we're dealing with a very serious disease sometimes that can cost lives. And I've seen patients that I didn't want to see die, who would otherwise be here today because of coronavirus.
Yeah, let's come back to you, Barry, on that, because, of course, you held your hands up and said that you had compromised social distancing rules when you went on that protest, and we saw Matt Hancock in Parliament. I mean, has that affected you and your fellow politicians in regard to how the spotlight is being shone on you? Because we look to you as an example of how we should all behave.
Ben, look, I didn't go out on that protest to break social distancing rules. I went out to show those young, courageous people that someone in Parliament agreed with them, that this is not just a time for protest, it's a time for change.
Absolutely. The reason behind going, no one would criticise your reason behind going, but
sure.
the rules are...
It was going to be very difficult. to observe the social distancing rules when I was out there. And that became clear when I was there. I totally agree. That's why I held my hands up. I said, look, in fact, the night before, I'd received test results that said I was negative. And since then, I've had 2 weeks at home isolating to make sure that if I'd contracted anything, then I didn't pass it on. So the social distancing rules are absolutely important, you know, and it's absolutely right that we're observing them. I pay tribute to Dan for the work he's doing on the front line. And of course, every day I'm working you know, with my casework that's coming in, trying to help people through the most appalling experiences that they're going through in life. So social distancing does matter, and we must all try and get this right.
We have had a statement from the chair of the NHS's Test and Trace programme, Baroness Harding, who said our response to this virus has and will continue to be as part of an international effort. That is why, as part of a collaborative approach, we have agreed to share our innovative work on estimating distance between app users with Google and Apple, work that we hope will benefit others while using their solution to address some of the specific technical challenges identified through our rigorous testing.